Hello, I'm Michael Pierce, and this is The Human Condition. Welcome. Today, our topic is a very special one for me. I'm going to try to annoy as many people as I can with neurofeedback and mental wellness. We're looking at the connection between the airway, breathing, and brain function. This brings together a whole bunch of professions. It brings together the chiropractic profession, the dental profession, and an orthodontic profession, which I'm going to try and annoy quite a bit today, along with a bunch of others. It brings together the nutrition and naturopathic type of people, the nutritionists and dietitians that look at diet. And it looks at sleep and brain chemistry and brain science with regard to the doctors that treat people with psychology, people that are therapists, marriage and family counselors, social workers that treat children and adults for mental health problems, because it's all related to the airway. So what is this airway? Let me show you a CT scan of the airway. I want you to see what it looks like, because it's important to understand what this airway looks like. I'm going to kind of bounce back and forth between my slide and my little model here. So let's take a look first at the slide you can see. And what I'd like you to see there, you can see their nose. This is a side view of a person in profile. So you can see the nose. We've got our mouse moving around the nose. We've got our mouse moving around the lips now. We're looking at the lips and the teeth. And then you can see the tongue volume, which is the tongue. And the tongue takes up most of the space. And it's where it's supposed to be, at the top of the mouth, covering up without leaving a lot of space, a lot of air in there. And then there's an airway, which is this black column that goes vertically. And that's the airway that goes up and down. And you can see that as the actual throat. And that's the airway for which you breathe air through your nose and mouth, and you swallow food. And you can see the epiglottis, which divides that, so you can decide whether you're going to swallow food, or you're going to breathe air, or you're going to swallow air, you're going to choke on food. And so that's the whole process. And that airway can become narrowed. That airway can become narrowed if a person has problems. Now, there's a couple of main causes, a couple of main root causes for this airway problem. One is dental work. Sometimes the dentists will have a person, let me just move a slide here for a second. Sometimes the person will have these airway problems where they've gotten some teeth removed in order to deal with some problem of their teeth alignment. So they had problems with their teeth. And so a dentist said, well, I've got to remove some teeth or give you some braces or do some things to manipulate your mouth so that your teeth look straight. And sometimes if they do that, they can cause recession of the mandible or repositioning of the mandible. And in some cases, they're not fixing the root problem. And what they're doing is they're saying that perhaps they ignored or missed a cause, which was poor development of the maxilla because of lack of breathing and lack of airflow and improper position of the tongue because of some other cause, which I'm going to get to. And that led to small development of the upper arch, and then the lower arch recessed and ended up being fairly receded in the back of their head. And if you remember that previous picture, if the jaw receded back and the position of it came back into their head like this, which often happens from forward head posture, the patient gets forward head posture, their jaw comes backward. And when their jaw comes backward, they have this airway just literally pinched and closed off, because from the side it gets compressed. So you get a compression from dental removal of teeth and dental lack of awareness of the growth of that upper arch and that hard palate and soft palate. So sometimes it comes from goofed up dentistry and goofed up orthodontia, but we have to ask, what was the original cause that made that happen? And the original cause of what made that happen was often swollen mucous membranes. And the swollen mucous membranes inside the nasal sinuses and inside the throat and in the all the way down the entire gut process, all the way to the end where it all comes out, is often food sensitivities. So if a person has a problem with a food sensitivity where they're eating something, most commonly something like gluten or dairy or some other kind of grain or lectin or bean or nut or seed, that causes a problem, or even a mold allergy or a tree allergy or a pollen allergy, all of which is made worse by food allergies, by the way, the person will have this swelling over time, this slow swelling of their sinuses. And as the sinuses swell, the airway gets smaller. And if that happens, you don't breathe through your nose and you don't use your nose in your maxilla, and you get a shrinkage or a lack of growth. If you're a child, a lack of growth of this maxilla, and it doesn't grow outward like this. It doesn't have a nice wide growth. And then the mandible doesn't grow, and the mandible often recedes. And often that person also leans forward to have forward head posture to open up their airway. And when you lean your head forward, your jaw recedes. And so it looks as though the jaw is pulled back and the person has forward head posture all at the same time. So swollen mucous membranes, airway problems, mucus production, lots of infections, ear infections, nose infections, throat infections, because of course bacteria love all that mucus that's produced. So what happens is they get that their airway closure, and they go to the dentist because their teeth don't look pretty. They look all misaligned, and the dentist puts them in retainers, and they put them in different braces and tries to line their teeth. And then they say, well, there's not enough room, so we're going to remove 4 teeth that you don't need anyway, they think. And when that happens, everything just shrinks back down again, and we have the same problem of a reduced airway. So if you've got this reduced airway, how do you assess it? Well, you go to a dentist and you get these CT scans like I just showed you. That particular CT scan that I just showed you is a really, really great one. And it's part of how we assess the airway and track and see if it's too small and if it needs to be helped and corrected. And there are ways to reposition the mandible, reposition this bone right here. This is the mandible, and reposition it so it can come forward and so that it can have enough space so that there's room back here in the throat for a person to actually breathe. So that's part of the understanding of assessment. So you go to a dentist or orthodontist that has these CT scans that you stand up. Now, some people are worried, am I going to have to lay down in a little tube and I'm not going to be able to move? Am I going to feel claustrophobic? No. These CT scans are very fast, and they're upright and they're wide open, and you just stand there and you put your chin on a chin rest, and the camera moves around and takes your picture of your CT scan and shows your whole skull bones. It shows your whole face bones, all your teeth. It shows your airway and your tongue and all of that. It even shows your vertebrae, as we talked about. So that idea of assessing airway problems by history and physical examination and watching a person, because the children will have those allergic salutes or allergic shiners where they've got the dark spots under their eyes. If you've ever seen those black spots under the eyes, you may have seen the allergic salute where the child does this and they wipe their nose like this because they've got constant drip. They've got postnasal drip, and they've got a nasal drip here at their outside of their nares as well. They've got snot hanging. They often clear their throats all the time. They're mouth breathing, and they look like they're suffering. And of course, they don't get oxygen and perfusion to their brain, so they can't function in school. They end up getting accessory diagnoses like ADHD and sleep disorders. They get fatigue. They get oral caries and cavities from dry mouth, from mouth breathing. So they get all kinds of problems, and this can all be addressed and reversed if we all work together and look at the problem. The International Association of Facial Growth Guidance is my next slide. And so what I want to do is I want to talk about this group of people that are orthodontists that are saying sometimes, and boy, I love this, sometimes we don't have to assess and treat people with braces. Sometimes we can use minimal braces and minimal tooth interventions and minimal surgeries and minimal retainers, and we can use mouth exercises. This is Mike Mew and his father, John Mew, and they are both dentists in Britain who have formed this organization to study the mechanisms of chewing and swallowing and mouth exercises and tongue exercises and breathing exercises to allow us to have better control of our airways and better spread of our teeth to keep them apart so that they don't collapse on themselves, because they will tend to do that. And it works really well. And it really angers a lot of dentists because it avoids the use of expensive braces and retainers to some degree. And that makes people mad sometimes. It very much can help align the skull and align the cranium and align the upper spine, which helps the chiropractor get their job done better. And the assessment will be involved. So I guess a complete assessment would be seeing a dentist, getting the CT scan of the head, and getting the chiropractor to x-ray the neck, because you need the chiropractor to x-ray the neck and see what's going on if it's a very difficult case. So that's what that website is about. It's about how to assess and how to treat people using exercises to reduce the use of orthodontics and expense. So what are the brain effects from airway reduction? The brain effects in my outline here are that the brain suffers from hypoxia. You end up getting less oxygen perfusion when you don't breathe as well, and you have a blocked airway. If someone has their head forward and their jaw open and their mouth open and they're breathing through their mouth and not their nose, and their jaw is receded and their airway is reduced, and they're compensating for all this, they're not going to do very well in school. They're going to be diagnosed with ADHD. Sometimes they're going to get sleep disorders. They're going to have either narcolepsy or insomnia. They stay awake all the time, or they fall asleep at odd times. They're fatigued all the time. They're going to need energy drinks. They're going to get sick because they have open mouth breathing. They're going to inhale bacteria. They're going to get more infections. The mucus that they have in their body is going to give them more mucus, and they're going to harbor more infections in their ears, nose, and throat, and their sinuses. So the brain will suffer from this hypoxia. And you may see that on brainwave effects. You may see some kind of global hypoxic showing up. You may see what the EEGers call the slow edge of alpha waves, which is slowish alpha waves versus fast side of alpha waves. In that frequency from 8 to 12 hertz, you'll see a predominance of the lower slowed alpha, 8 to 9 hertz, that range, instead of the higher end of 11, 12 hertz of alpha. You might see global slowing. You might see problems with mucus and that spitting that I talked about, where the person has to cough and spit, and they just can't clear their throat. Constant throat clearing. You'll see dry, cracked lips and angular cheilitis in some people. So these are some of the brain effects and body effects of airway reduction, and we really can avoid them by looking at the root causes. So let's look at causes and methods of treatment for airway and airway compromise. Now, I work with a team of people that are all over the world and that bounce around and do different things. So I'd like to introduce you to Michal Nizielski. And Michal is working in New York as well as in Poland. He's part of the Postural Restoration Institute, and he's a physical therapist that works on airway and development and the whole process of how does one breathe and recover from breathing. So he's going to take a person and take you or your child and do either live consultations here in Boulder, Colorado. I'm in Denver, Colorado, but near me in Boulder, Colorado, or in Southern California, or in New York at different seminars, or possibly in Poland, and possibly online with you and your dentist or your orthodontist or your chiropractor. This is a process and an organization that Michael does, that is an educational institute and a clinical institute that helps people restore their posture naturally. So that means you've got to look at everything from your ankle all the way up to your cranial bones. You've got to look at your cranial bones and sometimes have them manipulated. You've got to work on your cervical spine. Your rib cage is a big part of what Michael does. The concept of how the ribs move during breathing naturally and how the body moves. And so that type of rehab is extremely important to both assess and treat airway problems. And Michael works with these teams that I'm introducing you to. The next slide for us is the About Us slide for Canyon Chiropractic. And this is the practice of Dr. Craig Pearson, who is a chiropractor here in Boulder that is a specialist in SOT, or sacro-occipital technique. And so he works with our group of people both in California and in Europe and in Boulder, Colorado. And his clinic in Boulder is a clinic that's integrated chiropractic with dentistry and physical therapy, where we work with brain waves and we try to figure out what's going on with the brain waves. We try to figure out what's going on with the airway, and knowing that you can't correct a cranial problem unless the pelvis is level. He uses sacro-occipital technique and dietary and iodine methods and all kinds of wonderful holistic methods to try to begin to fix the pelvis and make the pelvis and the feet level and the lumbar spine level and the rest of the spine level, and ultimately the atlas and the skull, which is, the atlas is this first vertebra, and the skull level, so that the person doesn't have some postural distortion like this or some kind of problem where they're not level and they aren't able to have a good airway in their throat, or a good airway in their sinuses, or a spine that is level and distributed evenly, because that can cause all kinds of problems. So that's Dr. Craig Pearson, very, very accomplished and established chiropractor who does this work here in Boulder, Colorado, and also consults in different places around the world. Among those teams for this work with this type of airway compromise is the Yorba Linda Family Chiropractic. This is a clinic that's not in Boulder. This one is in Southern California, in Yorba Linda. This is south of LA, just north of Orange County, at the northern part of Orange County. And this is one of my real buddies. You've seen him on the show with me. This is Dr. Bill Janek. We can see the top of the page, and that shows award, which is the number one chiropractic and integrative medicine clinic in Orange County by the LA Tribune. He's also an accomplished chiropractor, and he does this work and hosts this work with dentists and with psychologists, doing brainwave work, studying the QEEG of the brainwave, looking at the airway, looking at the CTs. He has a fantastic x-ray machine where he can look at problems with the neck and the ligaments in the neck and the alignment of the neck and the skull. And so he's part of this team that does this airway work in Yorba Linda, California. Next, the Vivos Institute, which is in Denver, Colorado. And the Vivos Institute is a business that is a very large company that has got the new first ever FDA clearance for an oral device that treats these airway problems. And so there are people that have problems with the position of their jaw and their airway compromise. And there's this device with Vivos is a very important device that is placed in the mouth, that is used by dentists. It's like a retainer, and it's placed inside your mouth, and it's an oral device, an oral appliance that's used to help realign the teeth and hold them in the right alignment, put the jaw in the right place, and allow the person to recover in breathing and sleep disorders, because sleep disorders are so important in this airway problem. This group is in Denver, Colorado, near the airport, which is, as you know, in Denver, kind of up north and east outside of town, where the airport is way out of town. So it's close to the airport, easy to access, easy to get to, and they teach dentists, and they have these patented devices and these FDA approved devices. So it's not the only device out there, but it's one of the first and most exciting devices that are used to place in your mouth for during the daytime and sleeping to help better breathing and deeper sleep. There is also in Southern California the Aviara Institute. This is the Aviara Center. This is in Orange County. This is not very far from Dr. Bill. This is Dr. Catherine Ann Wallace, and this is a dentist and a dental practice that includes and integrates all of these types of things together. They've got physical therapists, they've got Michael, they've got Dr. Bill, they've got me sometimes, they've got all these doctors and dentists and physical therapists working together to try to figure out what's going on. And so they try to figure out, how do we read the CT? How do we read the X-ray? How do we look at the airway and look at the alignment of the teeth and the alignment of the pelvis and put it all together to figure out how a person can get over a sleep disorder, how they can get over a brain problem, how they can get over ADHD by prioritizing and figuring out what's the biggest problem. Is it food? Is it mucus? Is it the airway? Is it the mouth? Is it the jaw? Is it the position of the jaw? Is it the alignment of the neck? Is it the alignment of the sacrum in the pelvis? What's the priority? Because some people need all of this, but some of them need something first and something second and something last, and they have to prioritize it. And it takes skilled clinicians to work together without big egos to be able to work together. And it's a lot of fun working with these professionals because we all work together to try to figure out what's the priority. Because I'll tell you, sometimes when I am on a case, I'll say, look, brain waves are the last thing we're going to do with this patient. We've got to deal with airway first. And I'll step back and I'll say, look, as a chiropractor and a neurofeedback guy and an EEG guy, I'm going to say I'm the last fiddle. We need to do the first thing, which is going to be, in some cases, the airway, the food, the diet, the dentistry, the oral appliances, and then the chiropractors step in, and then the EEGers step in, and the psychologists and the counseling and the brainwaves, but not until we've had weeks of care with the other types of stuff. So that's some examples of providers for help and some of the examination of root causes. And by putting all this stuff together, we can help a child's development happen, whether they've had teeth pulled or not, whether they've had jaw surgeries or not. There's all kinds of hope to try to reverse these kinds of problems and to try to understand what's going on and in what order and how they should be treated, and use evidence-based medicine to understand what's really the root cause, instead of just slapping braces on them and just making them have pretty teeth without looking at all the other factors. Because if you just slap braces on somebody or a retainer, or you just crack their neck, or you just give them an antihistamine, you could have them look better and have a symptom relief, but overall they could feel worse. And so that problem of feeling worse and being worse and growing worse, especially if it's a growing child, can be a real problem. The growing child may not develop, and you may miss a phase where they could actually grow their skull and expand that airway. It's exciting to do cranial work, because between the dental work and the cranial work and the chiropractic work, we can sometimes even change the position of the skull and change the alignment of the face. There you will see providers like Dr. Bahar Ismaili. She's a dentist who will be involved in some of these cases and coordinate many of these cases. She will be sometimes in California, sometimes in Boulder and Denver at Vivos Institute, and she will be coordinating these types of cases. And Bahar will be associated with the Vivos Institute and the Aviara Institute at times, and with all of us working together to try to understand what's going on for these patients. So I hope this has been beneficial for you, and I hope it's been a nice review. So please provide us feedback. Tell us what you think. Give us questions, and let us know if you'd like more on the topic of integrated dental, chiropractic, and psychology with Airway.